3, 2, 1.
Dr. Jarrett.
Express yourself freely every day. Whatever makes you happy. Pop quiz. What nerves am I testing right now?
36 degrees Celsius.
Welcome to another episode of the Specialty Collective. I'm Dr. J. Feldman, where we bring in some of the top specialists in the United States to talk about what their field is really like, so that when you finish medical school, you can make the right decision on what field that you want to go to.
Let me ask you, what really makes a good doctor? If you're not happy, how are you supposed to help your patients?
On this episode of the Specialty Collective, we're talking about anesthesia with one of my best friends and one of the best anesthesiologists that I know, Dr. Jarrett. Dr. Jarrett, welcome. Thank you so much for joining me today. Today we're going to be talking about anesthesia. Dr. Jarrett here just finished his anesthesia residency, and tell us a little bit about anesthesia.
That's literally why I'm wearing this, because I'm still sweating from anesthesia residency. No, it's actually not that bad, I'm kidding. So about anesthesia residency, because I can talk to you for hours about both of those topics.
You know what, start off, just tell us a little bit about yourself.
Okay, so my name is Dr. Jarrett Schanzer. I'm from New Jersey. I did all of my training in New Jersey. I grew up in Mattawan, moved to Homedale, New Jersey in second grade. I went to college at Rutgers University in New Brunswick, but that's after I transferred from Muhlenberg College in Allentown, Pennsylvania, a little itty bitty 2,000 student college, which I realized quickly was not for me. I did medical school in South Jersey at University of Medicine Dentistry of New Jersey, which is now known as Rowan School of Osteopathic Medicine. And I completed a master's in nutrition at Columbia University in New York City. And afterwards, I did my residency training at St. Joseph's Regional Medical Center in Paterson, New Jersey, where I completed a 3-year residency in anesthesiology. And I also did an intern year prior to anesthesia at Meadowlands Hospital in New Jersey as well.
Awesome, thank you for that. And if you want to follow Dr. Jarrett on Instagram, his Instagram is Dr. Jarrett. Puts up some really funny stuff. And we're going to talk a little bit about that after. But first, let's kick this thing off. Talk to me about anesthesia. What is anesthesia?
So anesthesia is essentially a medical specialty that deals with the comprehensive perioperative medical care of patients before, during, and after surgery. In short, it's a little more complicated than that.
Short
but
and
that's
sweet.
basic.
I like it. How many years of training does it take to become a licensed anesthesiologist?
So depending upon where we're starting, basically in the United States, you start with 4 years of college, which you can do an accelerated program. You do 4 years of medical school. You do an intern year, as well as 3 years of anesthesia residency.
Okay, so 4 years in total.
4 years post-medical school.
Gotcha, awesome. So why did you decide to go into anesthesiology?
So for me, anesthesiology was actually not my plan A first choice. It is something that sort of I discovered along the path to perioperative care. Initially, I actually wanted to go into orthopedic surgery. So I thought I had the muscular strength for it. Not really, they used to be bigger. What I really loved was hands-on medical care of patients, basically doing things that allowed me to apply all of my medical training in medical school, but also do something different, not just the run-of-the-mill primary care. I wanted to do something interventional. I wanted to be able to do procedures, and whether that meant being on the other side of the curtain actually doing surgery, or being on the back side of the curtain, starting IVs, intubating, placing central lines occasionally, doing various different procedures. And then I soon discovered that anesthesia afforded me the ability to do everything that I wanted, while also being able to see incredible procedures and be privileged to see things that most people will never be able to see in a lifetime, while also maintaining all of my medical knowledge and training. If I went into orthopedic surgery, I might have just been kind of pigeonholed into this field and become a sports medicine expert, but all that medical knowledge I had without being used over years would slowly fade.
Yeah, totally understand. So I happen to know that you just got off of work this morning at 7 a.m. You just worked a 12-hour overnight. Tell me a little bit about what a day in the life of an anesthesiologist is actually like. What are you doing from the start of your shift to the end of your shift and everything in between?
So there's a lot of flexibility in anesthesiology depending upon where you're working, what hospital you're at, if you're in a major city, if you're in the suburbs, if you're at an outpatient surgery center. if you are working on healthy patients outpatient or if you're working on very sick, ill patients inpatient. I will talk about what the majority of anesthesiologists are doing on a regular basis. Usually they're waking up relatively early. This is not a field to go into if you want to sleep late. I can tell you firsthand, most of the time you're going to be waking up around 6 a.m. or earlier. So with that said, you get to the hospital a little before 7 a.m., a little after 7 a.m., but usually 7 a.m. is the mark. Depending upon if you're in training or not, you might be there earlier, you might have education in the morning for 30 minutes, but you will go to your operating room, you will set up and plan for the surgery that you're about to have. Usually you don't set up for any other surgery than the one you're about to have because you want to keep everything sterile, okay? And basically afterwards, you'll go see your patient, you'll know what procedure you're doing, and then you'll interview your patient. You're basically going to learn everything you possibly can that's relevant medically for this procedure and all about the patient's history in 5 to 10 minutes. And then they're gonna give you their life. Not really, you're gonna sort of just be entrusted with it and be expected to apply a catered plan of anesthesia towards that patient's comorbid medical conditions and take them in and make them feel hopefully nothing. And if you do everything right, then they won't remember anything either, depending upon the type of anesthesia, of course. And basically, your day could vary from just taking a patient in for having sedation and giving a little bit of local anesthesia where they numb up the area, and you maybe put them in a twilight sleepy state where they actually might remember, and you explain that to them, that it's expected because they're still breathing on their own and there's just a little bit of anesthesia. And sometimes the surgeon wants them to be aware so that they can ask them questions in terms of location where they are, assuming they're doing maybe a pain management procedure with injections, epidural steroid injections. However, on the flip side, sometimes we do general anesthesia, where we basically put a patient under anesthesia to the point where they are not breathing anymore, and we take over for breathing. We place a breathing tube in their mouth, in their windpipe, and oftentimes we paralyze them so they can't even breathe. We put them on mechanical ventilation, which is a machine that basically allows us to assist in their breathing and breathe for them, and we keep them relaxed for the surgeon. So they're not moving at all during the procedure, they're paralyzed. So their muscles are completely paralyzed, and as you may recall, the diaphragm is a skeletal muscle and it participates in breathing, so they will not be able to breathe anymore if that muscle is paralyzed as well. And we control their pain by giving them different anesthetic medications to control analgesia, and that's kind of a little bit of the science behind it. But there's so many different surgeries that go on and so many different types of anesthesia that you have to curtail towards your patient and the procedure.
Yeah, a lot of variation in the medications you administer based on, I guess, what procedure's going on. Very interesting.
Absolutely.
All
No
right.
cookie cutter anesthesia for the most part.
Yeah, exactly. So tell us a little bit of some subspecialties that you can enter from anesthesia. I know about a couple of them. There's pain. What else is there?
So yes, pain management is a one-year fellowship that a lot of anesthesiologists decide to pursue following the 4 years of training post-medical school. For me, pain management was something that I enjoy learning about and strive to make sure my patients are completely comfortable. However, you have to respect and appreciate a certain type of patient in that field, and oftentimes you're not just treating pain, you're treating some drug seeking as well, but I digress. So in addition to pain management, there's also a critical care fellowship. Also, neurointerventional is another option, which is not as commonly pursued. There's cardiothoracic, which is very popular. So if an anesthesiologist trains, they can decide to continue to do open heart surgery, valve replacements. These are procedures that would generally be done by the training of a cardiac anesthesiologist. However, you don't necessarily need to have a cardiac fellowship to do cardiac anesthesia, because during your anesthesia training, you will be trained in everything. So a lot of times it's just based on your comfort, and if you enjoy doing those types of cases, you can continue to pursue them. In addition, there's also a pediatric anesthesia fellowship. So if you love working with the little ones and babies, generally the kids that are having surgery though are not super healthy going for procedures. A lot of these kids have very rare syndromes, conditions, and going for some major surgeries. If you want to do pediatric hearts, a lot of these go for 2 years of fellowship. So you can do pediatric cardiothoracic anesthesia. In addition, there's also obstetric anesthesia fellowship that one can pursue. However, if your training is anything like mine, you will feel very comfortable with placing epidurals and spinals, as I was actually the senior anesthesia resident on call covering the labor and delivery unit. So if you could do it at 3:30 in the morning, you could do it at 3:30 p.m.
All right, now I'm gonna hit you with some juicy stuff. This is where the fun questions come in, and some that you're not expecting. So I'm sorry, I'm gonna hit you by surprise for a couple.
All right.
And we're gonna get your reactions.
Story of my life.
So for every specialty, there's a couple of questions I like to, differ it up, because we all have our preconceived notions of what is anesthesia, what are they doing behind the curtain, what actually goes on. So tell me, you spend a lot of time in the surgeries, hours and hours, behind the curtain, monitoring the medications, and you're seeing TV, they're reading or they're texting. What's your advice when you're behind the curtain, or is it strictly work?
So when you're behind the curtain, your patient's life is in your hands. So if you are willing to take your eyes away from the target of what you're working on, if you're trying to go onto social media, if you're going to check an email, if you're going to send a text message, if you're going to go on and do something unrelated to your case, then you have to accept full responsibility for that, because if something were to happen and your attention was somewhere else, then it is discoverable at that second in time what you were doing, because everything is tracked. Mm-hmm. So with that being said, in the past, I think anesthesiologists had this sort of rep for doing crossword puzzles, and now it's being on their phone doing this and that. My attention is on my patients. Sometimes I don't even have a second to sit down because there's so much going on with the case, and I'm constantly on my feet doing things for the patient. And other times, yes, it's a little bit slower. You may have some time to sit down. You can look at maybe
Educational magazine.
An educational magazine, something like that, but your attention has to be on your patient, on your monitors. You're charting the vitals, you're keeping up-to-date information at all times. You need to know what's happening on the other side of the curtain, and basically staying busy. If anesthesia is something that you're interested in, I would recommend shadowing an anesthesiologist that graduated medical school, as well as a nurse anesthetist who is known as a CRNA, Certified Registered Nurse Anesthetist, and also an anesthesia assistant. In some states they're able to practice, and you can get a different perspective of anesthesia from each of them and maybe find out which one is right for you.
That's good advice, especially CRNA is a big booming field now. I've actually worked with a lot of them, and they're great.
Absolutely.
Yeah. Okay, so some more juicy questions. The people this is what they're really interested in hearing. And I want you to talk a little bit about how competitive anesthesia is, what scores you need to get in.
Okay, so depending upon if you are applying from the osteopathic realm or the allopathic MD realm, osteopathic is DO, allopathic is MD, or if you are coming from the Caribbean, which are also MD, you have to basically be in the top 20% of your class, generally speaking. It is one of the more competitive top 5, top 10 fields. So you want to get the highest board scores that you can get. Now, if you don't score the highest in your class, then you have to compensate in other areas. So what board scores for the USMLE? I don't think there's a minimum number, but I would think that over 235, 240 and up would be a great place to start to have a strong competitive score. If you are taking the COMLEX, I would think over 600 and up would be a great competitive score. With that being said, of course, there's variation.
Yeah, awesome. And the other thing that people generally want to know is how competitive is it? What's the lifestyle like? What's the pay like? So tell me a little bit about the lifestyle and a little bit about the pay.
So lifestyle is one of the reasons why I went into anesthesia. I wanted to be able to leave work and actually leave work physically and mentally. I didn't want to be called back in. If I think of anesthesia, I think of it a little bit like a shift, almost like emergency room doctors, they do a shift. So once you leave, you can't get called back in. You won't get called about any issues with patients. You won't have to do any discharges or admissions. You are basically finished with your shift, and that's it. Anesthesiologists generally work in residency between 60 to 80 hours a week. 80 hours is the cap for every program. If you go over that, then there is possibility for you to appeal to the governing board, ACGME, AOA, and let them know, because there's a limit on the number of hours that you can work. In general, anesthesia attendings work about 40 to 60 hours a week, maybe even more, maybe even less, depending upon what you want to do, where you want to be. And that's what I love about anesthesia. There's so much flexibility. You can grind your ass off and make as much money as you want. The sky's the limit. You can make 500,000, you can make 750,000. However, you might not be in the heart of Miami Beach or New York City or Los Angeles or Chicago making that money and also only working 40 hours a week and having time to enjoy that lifestyle. So it's a trade-off. I think of it as three things, okay? There's the location. I'm in Miami now and I'm happy. There's the pay. The pay here is good. The pay is not the same as if I was in Iowa or Wisconsin, but the pay is very good. And then the third is the job. Where are you working? Do you like the job? How are the hours? How are the people? Do you dread going to work or do you love going to work? You can't get all three, but you could strive for it. And if you can get almost all three, that's amazing. Or two out of the three. You gotta choose what you like, what you want, what you're looking for.
I like that advice, that's great.
And lastly, the average income for anesthesiologists, as you mentioned, it varies. So it can be $350,000 on average in the country. However, it'll drop and be a little less, and it'll go up and be a little bit more depending upon where you're working, how much you're working, what the job is.
Awesome answers. Okay, and a follow-up question to that is you hear a lot about malpractice lawsuits involving anesthesiologists because of course you're liable for everything that happens for this patient when they're under general anesthesia and everything else. Have you ever been subject to one of these lawsuits? Have any of your friends?
I have not been subject to any. However, the company that you work for, your employer, essentially is going to have you under a high mal insurance package. And as long as you do everything by the book, you chart everything as you should, you do everything you're supposed to and follow the guidelines, then you will have a leg to stand on in court, you'll get a great lawyer, and you'll be fine. But unfortunately, in the society we live in today, this is a huge issue and you have to be extremely careful.
Yeah, absolutely. If you could go back to medical school, 3rd, 4th year, would you choose something other than anesthesia, and what would it be?
That's a great question. Can I go back before medical school, not go to medical school? No, I'm kidding. I love medical school. I love everything. I love where I am.
I love it.
I'm so happy.
You're so happy.
I'm so happy. I love my life. Okay, if I can go back, would I do anything different? I would maybe do what you're doing. I think medicine and nutrition and holistic and preventive and lifestyle medicine is the wave of the future. And my dad and I talked about this for a long time, and it's what I should have gone into, but I steered away from. But I may find myself moving in that direction. So I think a primary care specialty, even though nobody is moving towards that direction nowadays, is something that I love and am enthusiastic about, and that's what I do and promote on my Instagram and in my life. So why not do what you're passionate about so you never work a day in your life? Now, I am passionate about anesthesia and I love it too, but I also love the lifestyle and that I'm not grinding really hard, but meeting the middle hours so that I can enjoy my life a little and do other things that I enjoy.
Awesome. Yeah, and I think so too. I think primary care is it's a very frowned upon, not frowned upon, but looked down upon in the medical community as like a lower specialty. But I think that's absolutely where the future of medicine is going, and that's what I see myself doing. So great answer. The final question, and again, I didn't tell you I was gonna ask this one, but it's one that everyone likes to hear. So every specialty kind of has their own stereotype. You know, orthopedic surgeons are the bros. What is the anesthesiologist stereotype?
The anesthesiologist stereotype, I would have to say, is kind of like this nerdy but cool kind of guy or girl, and they know how to have fun, but they're also really smart. They know what they're doing.
Cool, nerdy guys who can party, and hold a conversation. Yeah? The cool, nerdy guy.
The cool, nerdy guy who knows how to have a good time, or can be a girl as well.
Man or woman. Dr. Jarrett, thank you so much for joining me today. If you guys are interested in seeing more of Dr. Jarrett, follow him on Instagram. He's huge, posts a lot of hilarious content. That's, what is it, at Doctor, all spelled out.
DoctorJarrett, at Dr. Jarrett on Instagram. Also have a YouTube, Dr. Jarrett as well. And your anesthesiologist is also someone that can make you laugh and makes you feel great, not just good. And hopefully, so you don't remember anything from the surgery.
They make you feel great, and not just because of the drugs. They're cool guys.
They make you feel good because of their words and the energy that they convey to you.
Thank you, Dr. Jarrett.
Thank you, brother. There's a light right there.
We just banged our heads together. That's love.
That's what brothers do.
Until next time in the next episode of the Specialty Collective, thank you for joining us and you have an awesome day.
Express yourself freely every day. Whatever makes you happy. Pop quiz. What nerves am I testing right now?